As men age, changes in the metabolism of the most important male hormone, testosterone, which stimulates cell growth, begin in the male body. When the balance of growth factors is disturbed, antral gland cells accumulate and benign antral gland hyperplasia begins. Generally speaking, the cells of the prostate tissue continue to grow, the mass of the tissue increases until it begins to press on the urethra, making urination difficult or completely impossible. Benign growth of prostate tissue is diagnosed in about half of men over the age of 50 and is found in up to 88%. For men ages 81 to 90, if left untreated, this disease can lead to urinary tract infection, bladder stone formation, or kidney failure. When benign prostatic hyperplasia begins, it may show mild symptoms for a while, and only with time will symptoms such as delayed urination, weakened urine flow, increased urination, feeling of incomplete urination, interrupted urination, etc. appear. Eventually, the untreated patient develops urinary retention and requires emergency care. Head of the Urology Department of the RVUL Dr. A. Gazauskas says that there are no clear risk factors to help predict which man will get prostate cancer and which will not, so a preventive visit is one of the main means of diagnosing the disease at an early stage. The doctor signals disease at an early stage. The doctor points out that there are still cases in which patients of the previous generation avoid getting checked as a preventive measure. Apparently, this attitude is a remnant of before. However, I can be really happy that younger men are more interested in taking care of their health and definitely come for preventive checkups more often, so we can help them. Women, wives, daughters also have a considerable influence on this, often encouraging men to care more about their health. The disease can be treated in a number of ways, depending on the severity of the symptoms, the patient's well-being, quality of life, taking into account the status of urination and the size of the protruding tissue. If the patient is bothered by symptoms of difficulty urinating, the excreted tissue is not large, up to 40 cubic cm or grams, drugs are prescribed to relax the neck of the bladder and facilitate urination and improve urination. Patient's condition. If the prostate is larger, the patient is additionally prescribed special medications which, if taken continuously for several years, can be expected to shrink the prostate. When the medical treatment is ineffective, surgical treatment is offered. A transurethral resection of the prostate is performed, that is, the protruding prostate tissue is removed through the urethra with an electric loop. If the prostate is larger than 80 cubic cm, the patient is offered laser enucleation of prostate tissue, HOLEP, where enlarged prostate tissue is removed with a laser through the urethral canal. When medical treatment is ineffective, surgical treatment is offered. A transurethral resection of the prostate is performed, that is, the protruding prostate tissue is removed through the urethra with an electric loop. If the prostate is larger than 80 cubic cm, the patient is offered laser enucleation of prostate tissue, HOLEP, where enlarged prostate tissue is removed with a laser through the urethral canal. Laser enucleation of prostate tissue is performed only at RVUL in Lithuania, and open operations are almost non-existent in the department he heads. The laser procedure has several advantages. We can remove up to 200 cubic cm of enlarged prostate tissue. The duration of the patient's treatment in the hospital is only 2 to 4 days. Since we do not make an incision, but use special instruments with a video camera to reach the exposed prostate tissue through the urethra, this reduces postoperative pain and the risk of complications. A person returns to a full life much faster in comparison. During open operations, an incision of about 10 to 12 centimeters in the abdominal area, treatment in the hospital can last up to 10 days. The possibility of pain and postoperative complications is greater. Preventive visits provide the opportunity not only to detect benign removal of prostate tissue in time, to prevent its progression and complications, but also they help to accidentally detect other urological diseases, small malignant tumors in the kidneys, bladder, and to start treatment at an early stage of the disease. Sometimes a patient who comes for consultation has no serious complaints, does not feel pain, does not hold urine, but tests reveal that the prostate is enlarged. There are also cases when the removal of the prostate is very advanced, but the patient still does not feel or only feels weak symptoms. That is why I recommend a preventive checkup with a urologist once every 1 to 2 years, even if you feel healthy and have no complaints. He recalls that Lithuania is implementing the early diagnosis program of the prostate cancer, intended for disease prevention in men ages 50 to 69 and men ages 45 and older whose father or brother has had prostate cancer. During the consultation, not only can the cancerous disease be detected, but also benign enlargement of the prostate can be seen. When asked if there is any need to prepare for a preventive visit to a urologist, contacting a family doctor and getting a referral to a urologist, it is also helpful to have standard tests, such as general and biochemical blood tests, as well as a PSA test and a general urinalysis. Before or during the consultation, patients answer the questions presented in the International Prostate Symptom Scale, which helps to objectively assess the patient's condition and the level of urination disorder. An ultrasound is also done to measure the size of the prostate, the amount of residual urine in the bladder, etc. After the diagnosis of benign prostatic hyperplasia, the urologist offers the most appropriate treatment plan. Currently, the waiting list for a urologist consultation at the RVUL Consultation Center is about 2 to 3 weeks.